So I pulled up the South Dakota Nurse Practice Act, and it came up under Chapter 36.9, Registered and Practical Nurses. And here you can see the breakdown. So it gives a definition of terms. That's always enlightening. And functions, practice of a registered nurse. Let's take a look. Many times nursing students are really surprised by what's in here, and I've gone through these with students in the clinical, like mid curriculum and near the end, and they at first they're like, you're not really very interested in it, but once they start reading through, they're shocked that it includes things like advocating for the best interest of patient. They can't even believe that this is actually in there, that it's very specific and laid out like that. Things like establishing nursing diagnoses. If you've ever heard a nurse educator say, I don't like nursing diagnoses, or kind of joke about them, maybe we need to take a step back and not do that, since they are still in our state boards, in our Nurse Practice Act. So we really need to rethink, what we say to students and how we play that out. Let's take a look at Minnesota's real quick. Again, it comes right up very, very quickly. Nurse Practice Act, let's see here what we can take a peek at. Does, of course, have nursing programs in there. Grounds for disciplinary action, immunity, nurse cooperation. Let's see. A nurse cooperation, a nurse who is the subject of an investigation. Sometimes this is really good for the students to know, because we want them to understand that holding a nursing license is a privilege. We've worked hard for it, and we want to make sure that we're not doing anything that steps outside that scope of practice. And NCLEX loves to test on this. For instance, they like to test on things like chain of command. And if we're not teaching that to students within the curriculum, and I don't mean standing in front lecturing and saying, oh, you have to follow your chain of command. I mean actually saying and demonstrating and role modeling that here's our organizational structure. If you have an issue, you need to go to your nursing instructor first. That is your chain of command. And then we have to make sure that we are really living that out and emphasizing that. We do not want them to call the dean because they think an issue is that important. That is not using the chain of command. And that will be tested on NCLEX, and institutions will not want to hire our nurses if they are not able to follow that. So things that can get them in trouble, let alone things that can lose their license, we want to help students to understand those. And then Pennsylvania is, because I'm from Pennsylvania, we just take a look. They all vary a little bit, and they all look a little bit different. So whatever states your students are in, I would encourage you to have them look these up. They're always surprised. Ours are pretty specific in Pennsylvania. Things like venipuncture, it tells you what our responsibilities are regarding these. It actually does refer to resuscitation and respiration, and it doesn't in other state boards. So get in there, take a look at these, and have the students look at these with you, and then ask them what they're surprised about and what their thoughts are on these.